Around 20 weeks of pregnancy, it's time to get the 20-week anatomy scan. But the ultrasound isn't just to find out the gender or to get cute pictures. It's a full head-to-toe check of your baby's brain, heart, kidneys, and spine, and everything else. In this video, I'm going to walk you through what we're actually looking at and what it all means. And make sure to turn your phone sideways because you're going to be seeing a lot of cute ultrasounds. By the way, I'm Diana. I'm a physician assistant. I'm a mama to four and the creator of the birth prep course, Own My Birth. And on this channel, we talk about all things pregnancy, birth, and newborn. And let me know in the comment section how far along you are or your loved one is. But now let's dive into the 20-week ultrasound, and make sure to stick around to the end because after I walk you through the scans, I'm going to talk about what you can do to make the ultrasound go smoother and how to get better images. Let's go. This ultrasound is sometimes called the anatomy scan. It could be called the comprehensive ultrasound or the anomaly scan, but it's all referring to the same 20-week ultrasound where they check your baby from head to toe. This is one of the most detailed medical checkups that you'll have during your pregnancy. It's a much longer ultrasound than usual, lasting anywhere from 30 to 60 minutes, and it's often done by an ultrasonographer whose job it is to look at the babies on ultrasound all day long. The goal is to get a full picture of your baby's development, your uterus, your placenta, and the amniotic fluid. So when you are done watching this video, you'll be able to see and understand what you are looking at on the screen. Now, when they're doing your ultrasound, they might not go in the exact order that I'm gonna go in, but they usually start at the top of the baby and then work their way down to the legs. Gender is usually last, but if you don't want to know the gender of the baby, make sure to tell the sonographer before the ultrasound starts so they know to have you look away so you don't get an accidental peek. So starting off with the close-up of the baby's skull and brain structures. Now, as you watch the ultrasound, you're going to frequently see the screen freeze and a line or circle will measure specific parts of the baby. And this gives us an estimate of the baby's height and weight. Starting off with the close-up of the baby's head, you'll be able to see the baby's skull and brain structures. They will measure from one side of the head to the other, and then they'll get a head circumference. Think of it like they are wrapping a tape measure around the baby's head. Now, inside the skull, you can actually see the brain structures like the cerebellum and then the lateral ventricles right here. This is also where they may detect concerns like neural tube defects or abnormal skull shapes. Next, we're going to look at the face. Now, this part is really fun to watch, but be aware that sometimes you can see the cutest images and then sometimes the baby pretty much looks like an alien. And it's simply due to the angle of the ultrasound. But they are going to look at the facial profile, and they're looking for things like cleft lip, and they're looking for symmetry of the nose and the eyes, and then the positioning of the jaw. It's also the part where many parents catch the first glimpse of that cute little button nose. Then they're going to make their way down the spine to the chest, and they're going to spend some time here because they will be looking closely at the baby's heart. They'll count the 4 chambers, which you can see right here. They'll check the valves, they'll look at the great vessels like the aorta and the pulmonary arch, which is fun because you get to hear the heartbeat. Always an amazing sound. And what they're doing is making sure that the blood is flowing properly and that the heart is forming as expected. Now, interestingly, congenital heart defects are among the most common birth abnormalities. So this part of the scan is incredibly important. I think seeing your baby this clearly often brings the "this is real" moment. And while the scan checks for physical health, it's also a reminder that 20 weeks marks the halfway mark and it's time to start preparing for the actual birth. So if you're watching this video and you are pregnant, trying to prepare for the big day, I've built an online birth preparation course specifically for you. It's called Own My Birth because the truth is many women walk into labor feeling wildly unprepared, even after 9 months of appointments, books, and apps. Own My Birth course gives you realistic, evidence-based tools to feel confident in the delivery room, whether you're hoping for a natural birth or you're planning a C-section or you're not sure yet. It's not about being perfect, it's about being prepared. So if you're halfway through your pregnancy and starting to think, wait, how do I actually do this? I've got you. The link is below if you want to check it out. Now moving on in the ultrasound. Next they're going to do a long view of the baby's spine. And they're looking at closure and alignment of the vertebrae to rule out a birth defect called spina bifida. They'll also check the neck and look for measurements called nuchal fold thickness, which can be associated with genetic conditions like Down syndrome and then structural issues like congenital heart defects. A thick measurement doesn't diagnose a problem, it just flags that further testing might be needed. By the way, there may be times when you'll see colors like red and blue swirling on the ultrasound screen. This means that they've switched over to Doppler mode, which is them checking the blood flow through the umbilical cord, the placenta, and even inside your baby's tiny heart and brain. And it's really cool to watch, but it's also really important because it helps to confirm that oxygen and nutrients are getting where they need to go and that your baby's circulation is developing the way that it should. Now, the ultrasonographer will continue down the abdominal cavity, and then they're going to freeze the scan and measure the abdomen like they are wrapping a tape measure around the baby's belly. You're going to see the stomach on the left and then the kidneys, usually one on each side of the spine, and then also the bladder. Now, these checks confirm that your baby is swallowing and peeing, and if you didn't know this yet, the baby pees in the womb. And in fact, by 20 weeks, most of the amniotic fluid is indeed made up of the baby's pee. Another fun part is when they look at the baby's limbs. They count their fingers and their toes, and then they're also going to measure the thigh bone or the femur. Now listen up, because this is important. If you don't want to know the gender, this would be the time to look away, because right as they scan the length of your femur, you might catch a glimpse of the gender, even if that's not specifically what they are looking at right then. They're going to be looking at other things too besides the baby. The umbilical cord is examined for the vessel count. There should be 2 arteries and 1 vein. The placenta is checked for location and structure, and they also estimate amniotic fluid levels to make sure there's not too much or too little. Now, they might switch to a transvaginal view to measure your cervical length, especially if you've had previous preterm labor. A short cervix can be a risk factor for preterm labor, but there are interventions if it's caught early. If you want to know your baby's sex, this is usually when you will find out. Now, sometimes it's obvious, and sometimes it's not so obvious, especially if your little baby is being modest or shy. If their legs are crossed in just the right way, it can sometimes be hard to see. For a male, they might say that they see the turtle sign, which is the tip of the penis with the scrotum behind it. And for a female, they might say they see the hamburger sign. When you can get a clear picture, this is what they're looking for, which is 3 parallel echogenic lines representing the labia majora and the clitoris. There are ways that you can help get better views of your baby, like drinking water before the scan. It helps fill your bladder, which gives a clearer window to see the baby. And also staying well hydrated overall. That's good for amniotic fluid levels in general. Now, other tips for the ultrasound: wear something comfortable and 2 pieces if you can, like leggings and a top. You'll need to expose your belly, so wearing a dress that you have to hike all the way up over your tummy isn't as comfortable. Also, don't stress if the tech is really quiet. The ultrasound techs often focus during the scan, and they might not be able to explain everything in real time. It doesn't mean that something is wrong. It just means that they are doing their job carefully. Make sure to ask for photos and video clips. A lot of facilities will give you printouts, and some even offer digital copies or USB drives, so don't be shy and ask for what they have available. Also, be aware that you might not be learning everything today. So if your baby isn't cooperating or a certain view isn't clear, you might be asked to come back in a week or 2 for a repeat scan. It's really common, and it's not usually a reason to worry. And then finally, make sure to write down your questions in advance. Now, the ultrasonographer may not be able to answer your questions, and they can't interpret results, but your provider will review the report with you afterwards, so make sure to write a list of anything that's on your mind. But hey, if this video helped and you feel more informed, hit the like button, and be sure to share this with a fellow mama-to-be, and be sure to drop a comment. What was the best or most surprising part of your pregnancy? I'd love to read about it. If you are new to my channel, I have done a pregnancy series walking you through pregnancy week by week. Every single video is specific to a week in your pregnancy. We talk about baby development, pregnancy symptoms, how to prepare, what to expect at your OB appointment, pretty much everything that you need to know about your pregnancy that week. That's what we cover in that video. So I'm going to link to that playlist right here. Click on that, and I will see you over there.